Well, yeah, it's been a long time since since we've talked. When was it? You were around 9 years ago in Madison?
No, more recent than that. I graduated in 2016. So I can't do math. Yes, 8 years.
2016 is 8 years. Yeah, that's
Yes, yeah,
about what I thought.
it feels shorter.
Because I remember trying to get you to go into pediatric ophthalmology, but your die was
Yeah.
cast.
Well, I still think that I do so much pediatric uveitis. The only difference is I don't do surgeries, but I see so many peds patients, and I owe that to you. It's because of you that I learned to be comfortable examining children. And when I talk to a room and the parents, and they usually have a bunch of other children around, and I say, I can tune them out. I remember you saying that. You're like, I can tune out your kids as long as you can pay attention to me. And so I use that line.
I just have to grab some. It sounds like something I would say. That's
Yes.
good. And so you do surgery, but not pediatric surgery?
No, I don't do any
No
surgery.
surgery.
So, no, I'm 50% clinical, 50% research. So I do a lot of research. I'm the director of clinical trials, sort of like what Barb was and now Mihai is for you. And in addition to that, I have my own grants. So I keep pretty busy on the research side, and 50% I do adult and peds uveitis.
You down your specific career path, and I'll caveat that both ophthalmology and then the subspecialty. Maybe I don't think you said you were in research and in the reading center for years before.
Mhm.
Was
Mhm.
it always with the goal of going into ophthalmology, or was that like a
Always.
career?
Always. So back, even if you take the clock back, I'm 100 years old. If you take the clock back, I did ophthalmology back in India before I came to the US. So I
Oh,
had already done an ophthalmology residency, and then I came to the US in 2004, where I did a master's in public health. But my concentration was public health ophthalmology, where I learned how to run clinical trials. I learned how to ophthalmic epidemiology. So I really learned all this, which is why I thought I would have a future with the clients because of the training that I had. And so after that, the program director of that, he hired me to stay on as a postdoctoral fellow. And then I spent 4 years on a uveitis project at Hopkins and at NIH. And so because of uveitis, I had to do just chart review. I was basically just data abstracting, and that is the source of many of my manuscripts. But I looked through 25 years almost of one person's chart. So it was like a virtual uveitis fellowship. I really got deep into the trenches of anterior uveitis, intermediate uveitis, and all of it. And then after that project ended, the grant ended, I came to the reading center, and it was a similar group of people running uveitis. So automatically I moved in the reading center. I was doing all the uveitis studies. So MUST and ELSOCA and all these uveitis trials. So I got involved again deeper with not just the chart review, but now looking at images of uveitis or interpreting those images. I was part of the DSMC committees. I was part of executive committees. So I really got to understand how a uveitis trial runs. So I think uveitis was my future, and ophthalmology was kind of the path I had chosen since I was, yeah, it was just going on and on in the same lines. It's fantastic. I think the DOS training was so solid. I came out feeling very strong with my uveitis training. Even when I went into fellowship, I felt like I was already prepared. I knew a lot. And the uveitis fellowship just helped me refine what I already knew. Same with the retina. I will add, though, that prior to my residency, I was in the reading center for 4 years.
I know.
So that also maybe, I'm a non-traditional candidate. You'll hear me say that often. I wasn't your regular candidate. I was a foreign medical graduate with 8 years of research under my belt before I even came into residency. So UW took a chance on me, and I'm so grateful for that, because I remember T telling me, we're not sure if you're trainable. And I was like, I promise I am, I promise. I told him that if Dinny Davis could teach me to grade color photos, then I can learn anything. So it's so hard for me to answer that question, because I think it takes a village. And now that I'm an attending and I train other residents, I realize how much we put in to train somebody. Like, we spend hours preparing the lectures. We spend hours thinking how best to explain something to somebody. And we store away all those pieces to pull out when needed. So I don't want to, if the reading center had a big influence on my life. So if I have to give names, Altoville Blody really stood out. Denis, Ron Dennis, they also really, really stood out in my career overall. But like I said, I matched into ophthalmology, but I didn't match into an internship program. And Dr. Sauer and Dr. Kaufman, they personally made phone calls for me, because if they didn't do that, I wouldn't have been able to join PGY1. So I think that, and then I came into residency and I tried my best to be an empty slate, because I wanted every experience to be unique. So I learned so much from my glaucoma teachers. I learned so much from the peds department, everybody. And I don't want to forget the role that my non-MD people played in my life, which is the technicians. They would tell me how to prepare to see a patient, because they knew the history of the patient. In the OR, Doreen in the VA, she would hand me an instrument when T was getting mad at me. She would hand me the instrument before I even asked for it. So you learn so much from them. The orthoptist, I still remember Callie and her example of the burger meeting in, I forget what that is also now, but I remember her teaching me that. So I've learned so much from Darla, from the nurses, from so many technicians, and I keep in touch with them still. I meet them on Facebook. I'm friends with a lot of people on Facebook. Chicago, I do want to have a shout out to Dr. Barney. He when he was trying to recruit me, he hand wrote me a beautiful letter, and he said that he predicted for me three things. One, that within 2 years I would get a grant. Within 3 years, I would have a teaching award. And within 5 years, something else he said, I can't remember now. And all of those came true. I did get 2 teaching awards already, and I did get a grant that I'm really proud of, 2 grants that I'm really proud of. And I think this is what he meant, that one day I would be recognized by my own alumni. So I do want to give him that shout out, that he always was really supportive and kind to me.
It's great.
I have my best memories of Madison. We had a huge group of friends, like huge. The Indian community, and I lived in Black Hawk. The Indian community is huge there. And my son, so when I came, we were in Madison before I had my child, and then I went to internship and I came back for residency, and I had a young baby at that time. And the amount of support and help that I got from everybody, it's like an army I had there. So I was really sad that we left and didn't stay. I think I do want more people to think about alternative careers, alternative like pediatrics, like uveitis. There are so few people in these fields that in the next 10 years, we may not have pediatric ophthalmologists, we may not have neuro-ophthalmologists, we may not have uveitis people. There are 100 uveitis people in the entire United States, 3 in Tennessee. I think you have 1.5 FTE in Wisconsin, the whole state. So we really need more people to invest in those subspecialties. That's a really tough one. I think the one thing I struggle with is the business of ophthalmology. We never think about it. We don't train on it. We might know how to code, but we really don't know how to code well. And I've attended so many coding courses, and I don't think it answers the questions I have, or how to be efficient in clinic. One way of being efficient is standing at the door and rushing out. That's not appropriate. And so there's a lot I learned slowly. Number one, always sit down and talk to people. Do not stand up and talk to people. So I started sitting down and talking to people, even if it was the 2 seconds before the injection. You sit down and say, so how's your diabetes doing? What's your hemoglobin A1C like? And I'm a patter, I'm a toucher. So I pat their hand or shake their hand or ask about grandkids or something, and then do the shot and leave. And I had to work on my cadence because I speak fast, and this is the South. So I really worked on slowing my cadence. And then I have a nurse who, if it's a very long and complicated conversation, then I'll say, okay, I'm going to stop here. And she's going to repeat everything that I said, and I'll be back. So it just was those small things that no one teaches you that.
Yeah.
So for me, academia has many buckets, and the buckets that I choose to invest in is patient care. I have a very robust clinic practice. Second is research, which I have 2 grants, plenty of clinical trials, and director of clinical trials, and then education. So I've been involved with the BCSC writing of the uveitis book since almost 5 years now. I'm an ABO examiner. I also write the quarterly questions for ABO. So I think that, and then I'm on the ARVO's PDEC, which is the Professional Development Education Committee. So I'm involved with a lot of education. But really, the one thing that I feel has been my biggest achievement is my son, who just went from elementary school to middle school. He got an award for citizenship award, which is given to one kid in the 5th grade. And I felt, because that is the one thing I've always wondered, like, am I a good parent? Am I giving him enough time? Am I able to teach him what I need to teach him? And this one thing, which probably he did on his own without my guidance, but I'm taking full credit for it. So that's my biggest achievement. I was able to balance my house, my son, and my work. So much. This is overwhelming. And as I said, I was a non-traditional candidate. I was not someone, people still reach out to me and say, how do you get into ophthalmology? And I say, I don't know. I spent 8 years doing research before ophthalmology, and they said, oh, that's too much. We can't work so hard. I spent a lot of time doing this, and then it was like a second coming. So for me to know that all of the people who chose me, who helped me get into residency, who invested in me, who believed in me, I think this is my answer to them, and to say thank you. This is my show of gratitude, that everything that they put into me is valuable, and I hope to keep returning this and turning this around to the next few generations, as long as I'm in practice and academia.
That's lovely. That's great.